America's teaching hospitals offer patients the latest innovations in medical care and best outcomes. As we look to the future, it is critical that we focus on solutions to address healthcare access, healthcare inequities, and ensuring a diverse healthcare workforce. I'm Janis Orlowski, and I'm here with Rosha McCoy and Dan Hashimoto to talk about patient care. We're right now in the middle of COVID-19, combined with the summer of national and international protests, bringing to the surface the importance of addressing systemic racism in healthcare and the lack of equitable access. Where do we go from here? Rosha?
I really think we need to take a big, deep breath and step back and really think about spending some time listening and engaging with patients, families, and communities.
While systemic racism and inequities to healthcare access have really come into the spotlight this year, these are deep-seated issues that are sort of baked into our society. And while the first step is recognition, what it's really going to take is action.
We need to not forget about what we just saw. Sometimes when there's an emergency and urgent issues going on, and we saw these disparities, when things subside, there's a tendency in every society just to then go on to the next thing, right? It needs to be sustained hard work that needs to continue to happen, and so that we don't face this kind of disparity again and that we're better prepared.
And I think getting the first-year medical students exposed to that is so key because they're the future. They're the people that are going to be taking up this call to action and implementing that as they go through their first few years of medical school, their research time, their residencies, and then into their careers.
People who live in rural communities, people who live in underserved urban communities, people who do not have good insurance, and people of color do not have access. The ability for all individuals to have access to physicians and to the healthcare system is a critical point, and I think it's key. I feel that we are on yet another cusp of significant change in technology, in innovation. During the COVID-19 era, we saw telehealth, which was only a tiny bit of our delivery service, just explode, and many more individuals deliver healthcare through a telehealth platform.
I think the data component is so big. You know, we now have access to such incredible amounts of data, unique types of data. The goal of using that data is to figure out where are the loose ends that we can tie up to make sure that we are delivering equitable care equally.
I think it's very exciting that there are some academic medical centers that are using technology to actually reach marginalized communities in a way to truly connect in care coordination and patient navigation and all of those pieces that are really important to tie this amazing technology and innovation to the bedside, to the what it means to the patient on an everyday level.
What makes me excited to wake up and come to work every day is my colleagues and my patients. I think about the days where I'm just burned out or tired, exhausted, and I think about how much of a jolt of energy I get when I have a really meaningful interaction with a patient. And so no matter how much technology gets developed, my hope is that that human element doesn't get removed from our clinical care.
Absolutely. Absolutely. I've always said that the most uplifting thing for me for any day is to walk in to a first-year medical school class. They want to change the world. They're terrific, and they're going to become colleagues of mine. And I think, you know what, the future is good.
I mean, what an amazing time to be in medicine, right? I think if anything, the COVID-19 pandemic has shone a light on what an amazing, privileged vocation we all have in it being able to actually be of service.